Welcome back to Gastrovision. I'm Dr. Qazi Suhail from Government Medical College, Srinagar. Today we are going to tackle what I believe is the single best challenge that beginners face in endoscopic ultrasound. That is understanding orientation at the duodenal bulb station. Let me ask you a question. Have you ever looked at a duodenal bulb endoscopic ultrasound image and thought, shouldn't the head of pancreas be on the left side of the endoscopic ultrasound screen and the body on the right? If you just nodded your head and said yes, then this video is made for you. This confusion is completely normal. In fact, almost every beginner struggles with this. But here is the good news. Once you understand the why behind what you are seeing, everything clicks into place and the duodenal bulb becomes one of your favorite stations. By the end of this video, you will be able to confidently answer these critical questions. Why does the head of pancreas appear on the right side of the endoscopic ultrasound image while the body appears on the left? Why is the portal vein on the left while the superior mesenteric vein on the right? Why does the splenic vein appear to enter the portal vein from the left side of the screen? Why is the papilla seen on the right side of endoscopic ultrasound image? What exactly happens to your image when you perform clockwise versus counterclockwise sweeps at the station? Let us unravel this mystery together. Before we dive into the endoscopic ultrasound images, we need to establish a clear mental picture for the anatomical relationships around the duodenal bulb. Why does this matter? Because understanding these relationships helps you predict what you will see when you rotate your scope in different directions. Now coming to the game changer, that is understanding transducer orientation. The structures in the duodenal bulb are best appreciated in the long loop position. What does this mean practically? After entering through the pylorus, you may need to give some extra controlled push to achieve optimal positioning. You are not just sitting at the pylorus, you are advancing beyond it into the duodenal bulb itself. Now, pay very close attention to what I am about to tell you, because this is the key that unlocks everything. At the duodenal bulb station, your transducer is essentially upside down compared to the GE junction station. Let me repeat that, upside down. What does this mean? The caudal end, that is the tail end of the transducer, is now superior, that's pointing upward. The cranial end of the transducer is now inferior, that's pointing downward. This is the complete opposite of what you have learned at the GE junction. But wait, there is more. The transducer isn't just upside down, it's also slanted. The orientation is caudal end is positioned slightly posterior, that's towards the back, while the cranial end is positioned slightly anterior, that's towards the front. So you have both a vertical flip and a slight anterior posterior tilt. Why is understanding this so crucial? Because without knowing the neutral position of your transducer, you cannot possibly understand what happens when you rotate clockwise or counterclockwise. You would be flying blind. Take a moment to visualize this orientation. Picture your transducer upside down, slanted, sitting in the duodenal bulb. This mental image will guide every movement you make. Now that you understand the transducer is upside down, let's understand what happens when you rotate. At the duodenal bulb, because of the inverted and the anterior posterior transducer position, the clockwise rotation sweeps your field of view from superior to inferior. You will visualize structures that are below your starting point. This brings structures like superior mesenteric vein into view. The counterclockwise rotation sweeps your field of view from inferior to superior. You will visualize structures that are above your starting point. This takes you towards structures in the liver hilum. Did you notice something? This is different from the GE junction. At the GE junction, clockwise rotation takes you to the left side of the abdomen, while at the duodenal bulb, clockwise rotation takes you inferiorly. The transducer orientation determines everything. This is why so many beginners get confused. They are applying GE junction rules to the duodenal bulb. Now let's pull all this theory into practice. I'm going to walk you through a systematic examination of the duodenal bulb, explaining why you see what you see at each step. Let's dive in. Your first task is to locate your landmark. Insert your scope into the duodenal bulb. Your mission is to find the portal vein. This is your landmark, your anchor point, your reference for everything else. Why the portal vein? Because it is large, it is reliable, easily identified, and centrally located. It is a perfect landmark. Now, let's understand why the portal vein appears on the left side of the screen. Consider the probe orientation. Remember, your transducer position is upside down and slanted. The portal vein is in the range of acoustic beams from the caudal end, that is the distal end of the transducer. As a result, the portal vein appears as a tubular anechoic structure on the left side of your image. As I have already taught you in my orientation video, structures in the range of caudal end appear on the left side of screen. Now let's trace the acoustic beam path. Starting from the caudal, that is the distal end of the transducer, the beams travel from the portal vein, then continue towards the pancreatic body. That is why you see the pancreatic body on the left side of your screen, appearing farther from the probe than the portal vein. Now what about the head of pancreas? The head of pancreas is in the range of acoustic beams from the cranial end of the transducer. As a result, you visualize the head on the right side of your endoscopic ultrasound image. You can also appreciate the main pancreatic duct running through the head in this view, appearing as a thin anechoic dot within the pancreatic parenchyma. So now you understand head on the right, body on the left, not because of some mysterious rule, but because of the transducer orientation. It is simple physics. Now turn your scope clockwise while maintaining view of the portal vein. What comes into view? The portal confluence, that critical junction where the superior mesenteric vein and splenic vein merge to form the portal vein. Remember what I told you, at the duodenal bulb, clockwise rotation sweeps your acoustic field from superior to inferior. The starting position is portal vein. That is a superior structure. After clockwise rotation, portal confluence and superior mesenteric vein are visualized. These are inferior structures. You are sweeping downward through the anatomy. At the confluence, look at the arrangement. The portal vein on the left side of the screen, superior mesenteric vein on the right side of the screen. Why this arrangement? The portal vein is in the range of caudal end of the probe. That's why it appears left. While as superior mesenteric vein is in the range of cranial end of the probe. That's why it appears right. Now observe the splenic vein entering the confluence from the left side of the screen. Why from the left? Simple answer. Remember, the pancreatic body is on the left side of your screen and the splenic vein runs along the pancreatic body. Naturally, it enters from the left. If you watched my previous EUS orientation videos, this should make even more sense. It's about understanding the spatial relationships and probe orientation. From the confluence, perform slight clockwise rotation. What comes into view? The neck of the pancreas with the main pancreatic duct clearly visible. Initial clockwise rotation is from hilum to confluence. It helps to trace the portal vein from liver hilum down to the confluence. You are sweeping from superior to inferior. Further clockwise rotation at the level of confluence. Now the field of view shifts from posterior to anterior. Why? Because of the three-dimensional geometry of the structures. Why do you see the pancreatic neck on clockwise rotation? The neck of pancreas is anterior to the portal vein. With continued clockwise rotation at the confluence level, you are now sweeping from posterior to anterior. Now follow the main pancreatic duct from the confluence area towards the body of the pancreas. To follow the body from the neck, you need to rotate back slightly counterclockwise. Why counterclockwise? Because the body of pancreas is slightly posterior in relation to the neck and head. Let me emphasize this principle again. At the duodenal bulb confluence level, clockwise rotation moves your view from posterior to anterior, while as counterclockwise rotation moves your view from anterior to posterior. Since pancreatic body is a bit at a posterior level in relation to the neck, you need counterclockwise rotation to reach it. At this point, if you slightly rotate big knob away from you, you will start observing the bile duct running along the transducer side of portal vein. Now slowly advance your scope while turning clockwise to observe as far as the head of the pancreas. Here is an important directional principle. Counterclockwise rotation shows the proximal bile duct that is closer to the liver, while as clockwise rotation shows the distal bile duct that is extending down to the papilla. Think of it as a scrolling up and down through the biliary tree. Now, coming to the question, why is the papilla on the right? Now you can answer this question easily. The papilla is on the right side of the image because you have already understood why the head appears on the right. The logical chain, papilla is near the pancreatic head. Head is in the range of cranial end of the transducer. Cranial end displays on the right. Therefore, papilla appears on the right. See how everything connects once you understand the underlying principles. Now, another question is, why is the bile duct closer to the probe than the pancreatic duct? The answer is simple. At this position, the caustic beams travel from superior to inferior. Since the bile duct is more superior and pancreatic duct is inferior, with the result the bile duct appears closer to the probe, which is more superficial on your image, while the pancreatic duct appears deeper. You can follow the portal vein and bile duct back towards the liver by applying down angulation and counterclockwise rotation. What you are doing, you are tracing the portal venous and biliary systems from the pancreas back up to the liver hilum. If you continue with counterclockwise rotation, you can visualize the gallbladder, because counterclockwise rotation takes you superiorly and anteriorly, exactly where the gallbladder sits in relation to the duodenal bulb. The gallbladder appears as a pear-shaped anechoic structure with bright echogenic walls. You have just completed one of the most challenging conceptual transitions in endoscopic ultrasound, that is, understanding the duodenal bulb station. If this video helped you understand the duodenal bulb, please share it with your colleagues and subscribe to GastroVision for more masterclasses on advanced endoscopic ultrasound techniques. Thank you.